begin. My name is Alex Schadenberg. I'm the Executive Director of the Euthanasia Prevention Coalition. We did about 6 weeks ago a webinar, and I think this one might flow even better. We're hoping. Anybody at the end of this who would like the information or to have the entered rating room admit. Okay. So anyway, anybody who'd like the information afterwards, we can send it to you. There won't be a problem with that. And so I'm going to begin, and it's 2 o'clock. This system's actually, okay, it's just, okay, hopefully it's just 2 people have entered waiting room, see waiting room. I suppose it wants me to admit all always. Okay, so we're using a waiting room this time, so I'm going to be admitting people as we go, and that's fine. And I'm going to move this aside so we're okay. Okay. So I'm going to do a little bit of philosophical talk with you. It's not really philosophical, to tell you the truth. It's more based on experience. And the question is well, what does it mean to be human? Because I'm contending that euthanasia and assisted suicide are sort of counter to the human person, that how we are and how this affects us, it's counter to us. And I'm going to go through this sort of information quickly. You might argue with me, and that's fine. But I base my views on the fact that as a human being, I have empathy, I have specific emotions and feelings and reactions, I have needs, you know, I can feel depression, I can feel pain and suffering, but it's all what we all as human beings experience. So this is what I'm coming from when I'm going to the whole issue of how this affects me as a human being, this issue of euthanasia and assisted suicide. I am convinced that even though every human person, we vary, that in fact we share common responses. Now, someone would argue with that. I think, though, that's a fairly basic sort of assumption. But when we're considering this issue of euthanasia and assisted suicide, let me see where we go with this, okay? I'm also arguing that the human being is a communal person, as opposed to being ruggedly independent, that we depend on the other. We need to be with others. And this is requiring me to admit people, which is sort of a funny situation because previous ones didn't require me to do that. So what I'm saying then is our loneliness, our depression, these are universal human feelings. This is what we experience as humans to different degrees, but we all experience this, and we can understand through empathy each other's place and what's going on. In other words, it is normal for me to feel lonely and to become depressed. This is a normal situation at times in my life. Okay. Now, why am I going with this? You'll see in a minute. So, in the same manner, physical or psychological illness and suffering are universal human feelings. It's an important thing to say this because Canada's euthanasia law allows for euthanasia based on physical or psychological suffering. But if it's based on physical or psychological suffering, and as those who follow what I'm writing about know that it's not been defined, then in fact, we're talking about universal feelings is what we're doing. The system should not be doing this to me. Anyway, nobody wants to suffer. This is another human reality. So as much as we all are human, we're all going to experience these things, nobody would like to suffer. Suffering has become, though, an acceptable reason to kill by euthanasia. And in some cases, it's the primary reason someone is giving for the act. As I have to apologize. So what's happening here is that we have this set up that I have to admit you to come in, and earlier I put admit everybody. And since this is, I haven't done a ton of these webinars, now it's requiring me to admit people, and I'm trying to do a presentation. So it's a very awkward situation for me. What can I do with it to change that? Because every time someone comes up, I have to admit them in. But I think it's going to end soon. It's 2:04, so maybe we're okay. Okay. Well, I think it's a little bit late. We should have done that already. That's fine. We're okay. So anyway, we need to be, so then let's get down to the brass tacks. We as humans, we need to be concerned about people who lose their hope and their purpose, because this is what is driving this euthanasia debate in Canada. People who feel that they've lost their purpose to live, they feel that they are suffering, and they're going through a difficult time. We also, we live in a culture of loneliness. We live in a culture of isolation and social abandonment. So the culture has shifted, and we know that. The factors that drive people to consider suicide or to seek an assisted death, I've stated to many people before that these are sort of becoming the normalized part of our culture, that we live in a culture of loneliness and abandonment. Many people say, well, suicide is not the same as assisted suicide or euthanasia, and I would agree in one sense, but in another sense, we recognize that these same factors are leading people to seek an assisted death. There are more people who now live alone, who lack significant community, who feel hopeless or feel that their life has no purpose than ever before. I'm arguing that this is driving this euthanasia mentality, this whole cultural situation. And now that euthanasia is legal, people are seeking death by euthanasia as a way out. These I would define as deaths of despair. I would also look at that and say, sadly, we have seen in the US, because the US, the data is more apparent, it's easier to look at because there's so much more data, that the suicide rates, for instance, during the COVID time have increased much quicker. And sadly, I would say this has a lot to do with this culture of despair, this death by despair. I'm just going to give you a little bit of stats here. For instance, in Ontario, you can see the euthanasia numbers have gone up significantly. We receive the euthanasia numbers on a regular basis here at the Euthanasia Prevention Coalition for Ontario. And you'll see that the numbers have gone up every single year. And now in the first 6 months of 2020, they are now at 1,127 for the first 6 months of this year. So you see that the numbers have continued to go up. There was some thought that it's possible that the numbers would go down during the COVID time, especially since quite a few physicians were not involved with euthanasia while the COVID crisis was going on in a serious way. But in fact, the numbers went up, is what the data actually shows. Now, this is important to recognize that nobody, now, I certainly predicted it, but no one was talking about the numbers of deaths we would have by euthanasia. Now, people who were involved in this issue, like myself, certainly recognized it, but even the Quebec Minister of Health in 2014 had stated that there would be about 100 assisted deaths per year in Canada, or in Quebec. Now, Quebec is much smaller than the rest of Canada, but I mean, if you look at the numbers, in fact, last year there was 5,631 reported assisted deaths. This is where we're going, and in fact there was 4,467 the year before, so that was actually a 26% increase, and it accounted for 2% of all deaths. And there's been 13,946 total deaths. So this has really come onto Canada very fast. It's a serious problem how fast this has come along. So the recent report just came out from Health Canada, and it showed that the most frequent reason for requesting, so part of the questions that the doctors are asked to fill out to give to the government information is, why are people asking for MAiD, medical aid in dying? And 82% said that they were asking for it based on a loss of ability to perform activities of daily life. Now, they weren't asked to only give one reason, but the primary reasons is what they were asked to give. And 78% said it was inadequate control of symptoms other than pain. And 56.4% was concerned about inadequate control of symptoms other than pain. Pain actually was 53%, but in fact, it was pain or concern for pain. So in fact, when we're looking at the data, it wasn't pain itself that people were necessarily concerned about. They were often concerned about possible future pain. Now, many of you saw the article that was published by Wesley Smith, which said that he pointed out that 13.7% had said they had asked for euthanasia based on isolation or loneliness, which would be about 770 people. I contend that that number would probably be actually higher because, in fact, they're talking about primary reasons. For a lot of people, they are not looking at their isolation or their loneliness as their primary reason, but that is one of the key factors that's driving them towards asking to have their life ended. What's interesting about the Canadian report that I was pointing out is that the Canadian report doesn't even attempt to try and uncover possible abuse of the law. When you look at the Canadian report, I'm not saying the people who were examining the data didn't actually look through the data to find out if there were some concerning issues, but the report doesn't report anything like that. Now, that's totally different than the Quebec report. The Quebec Commission report didn't have all the information in it, but it did show that there were several deaths which were considered to be not fit the criteria of the law. So in November 2019, which was the fourth Quebec report, it showed that 13 of the deaths did not fit the criteria of the law, which is actually a significant number considering the number of deaths, euthanasia deaths, that they had actually gone through in the reporting procedure. So what it actually meant was that the Quebec Commission was actually looking at if there were issues outside of the law, issues that did not fit. You can also see within the Quebec report that there was unreported assisted euthanasia deaths. Like you could see the unreported number as being a potential in there because they had different categories of reports coming from physicians, coming from the region, coming from the pharmacists. The federal report didn't even attempt to look at those numbers and issues. All they did is report the data from the reports. And where did the reports come from? They came from the physicians or the nurse practitioners who did the act. And I've always said, well, when you have that sort of situation, there is no way to know if there was deaths that were outside of the law, because in fact, doctors or anyone tend not to report issues that are outside of the law. In September 2019, the Quebec Superior Court Truchon decision struck down that natural death must be reasonably foreseeable in the law. So, and the federal government, as you know, did not appeal that decision. So this is not new information. This is what we've been going through for quite a few months in Canada. The issue with that was not that one thing it did, of course, is it then removes that you'd have to be terminally ill. That's correct. But it did something else. The law said that you could have euthanasia for physical or psychological suffering, but that your natural death had to be reasonably foreseeable. So there was a bit of a control mechanism in the law to say that you couldn't have euthanasia for instance, physical reasons or psychological reasons alone. You would have to also have that your natural death be reasonably foreseeable. That was not defined either, which is important. Natural death be reasonably foreseeable was not defined. The government, therefore, by not appealing this decision, actually opened the door to deaths for physical or psychological reasons alone, because you would not have to be terminally ill. And this is an important thing, because what does it mean to have a psychological condition that qualifies for euthanasia? This is a big question that we have right now. And this is the big question that we're going to be facing in the next year or so as this settles down into the future. So what the government did is they introduced Bill C7 on February 24th. And after they had this online consultation, some of you might remember that I published articles about the online consultation because it was a bit of a sham. I encouraged everyone to participate in the online consultation, but the fact of it is the questions in the online consultation were very leading. You would have to be either supportive or somewhat supportive of euthanasia in order to feel comfortable with answering all those questions, because they were angled in that way that you would support. Bill C7, though, is not limited to the Quebec court decision, even though that's why they're bringing in Bill C7. So Bill C7 permits euthanasia for incompetent people who made an advanced request. So who is that? People who let's say they have Alzheimer's or dementia, but had previously requested euthanasia, or someone, let's say, who has asked for euthanasia and now they're in the hospital and they have a massive heart attack, so they're incapable of responding to the doctor. We don't know now what they actually want because they're incapable of responding. And what happens then is the doctor could go ahead and do it anyway. I think that's very concerning, especially since the fact is that what that does is it takes away your right to change your mind, but it also brings up the Dutch case. The Dutch case in the Netherlands that recently went to the courts. It dealt with a case of a woman who was incompetent to change her mind, and she had requested euthanasia previously. So when the doctor came to do it, the woman had resisted. So the doctor put the sedative in her coffee. And then the doctor tried to lethally inject the woman, but she continued to resist. So the doctor asked the family to hold her down as she was lethally injected. As you might know, that went to the courts in the Netherlands, and the Netherlands court said it was okay because the woman could not have changed her mind. Bill C7 eliminates the 10-day waiting period when a person is deemed to be terminally ill. So what the law did is it left in this whole thing about natural death be reasonably foreseeable, which has never been defined. And it says that if your natural death is deemed to be reasonably foreseeable, you do not have a waiting period, meaning I could go to the doctor in the morning, ask for euthanasia, it be determined that yes, I can have it, and my natural death is determined to be reasonably foreseeable. I could die in the afternoon. In the same way, the law says that if your natural death is not deemed reasonably foreseeable, so that they say he's not dying, then there would be a 90-day waiting period, is what the law did. It reduced the number of witnesses for the euthanasia request. Why they did that, I think, is because if you look in the Quebec report, you'll see that there was a large number of euthanasia deaths that did not follow the full criteria of the law. And the one reason was they only had one witness sign it. The second issue is it creates rules for euthanasia when someone is not terminally ill or dying, which is the 90-day waiting period. I think Bill C7 is incredibly concerning. It does not define things. It leaves things in a growth point for Canada, but we still lack definition. So you're talking about euthanasia being allowed for someone for psychological reasons alone. I will say also that the law insinuates that euthanasia for mental illness would not be allowed in Bill C7, but in fact, they have not defined psychological suffering, and psychological suffering tends to be viewed within the context sometimes of mental illness. Therefore, it's very reasonable for me to say that someone with mental illness could be determined to be allowed to have euthanasia for psychological suffering. The Delta Hospice Society, this has been a crazy situation. Euthanasia was sold to us under the idea of freedom of choice and autonomy. And now you have the Delta Hospice Society who oppose euthanasia, who are being told you must do euthanasia. So what you have is a situation where the BC Health Minister, Adrian Dix, has said that either you will do euthanasia, that's what they've said to the Delta Hospice Society, or you will lose your funding. So as of this moment, the Delta Hospice Society has been told that in February 2021, they will lose their government funding unless they begin to do euthanasia. What's even worse is, well, maybe not worse, but what is even, how would you say, a greater issue to this also is the government is also implying that they're going to expropriate the building. What's important about that is that the Delta Hospice Society is an independent organization. They are not part of the BC government. So it's a very concerning situation to me indeed with this situation. So right now the Delta Hospice Society is busy selling memberships to prevent the euthanasia lobby from taking them over, because this is what's been going on. They're being challenged by a government edict to provide euthanasia, and they're challenging that in court right now, the Delta Hospice Society, and they're busy selling membership. So I would say that if you live in British Columbia especially, you should be buying a membership in the Delta Hospice Society. If you don't live in British Columbia and you want to help the Delta Hospice Society, you should be sending them a donation. The British Columbia government, as I say, is not only planning to withdraw funding, they're also looking at expropriating the Delta Hospice property. Now, the issue is here that the Delta Hospice building was built by the Delta Hospice Society. They fundraised, they built it. They did not build it with government money, but the land that the hospice is on is right across the street from the hospital. That is government land. So it makes it a very difficult situation indeed. It makes it, it puts them in a difficult place. The 2019 California assisted suicide data. So this is what we're seeing in California. There's an increase in assisted suicide deaths again by 20%. What I was trying to point out from the data that when I wrote the article about the California situation is the number of deaths where they have an unknown ingestion status. So how does the law work? Well, in California, Hawaii, and in Canada, how it works is the doctor who then prescribes the lethal dose, or in this case in Canada, does the lethal injection, is also the one who sends in a report to the government. Now in California, and very similar in Canada, if the government does not receive the report, they're in a very funny situation because they do not know what happened in that case. They don't know if that person died a natural death, and they don't know if it was a situation of euthanasia or assisted suicide. They just simply don't know. So when I'm looking at the data out of California, you see 150 cases out of the 618 lethal prescriptions that were written. There's 150 cases where the ingestion status was simply unknown. In 82 of the cases, the person was known to have died, but the ingestion status was still unknown. Now we know from Oregon and other locations that there is an underreporting problem. In the Netherlands, we know the data on that because, of course, they do studies in the Netherlands every 5 years, which they have not done in Oregon, and they've not done it in other locations. In Belgium, they have done it. So you have a situation where you do now understand there's underreporting and clear numbers. So in the Netherlands, in 2015, we know that the underreporting was about 23%, 23% underreporting rate. And you can see right here in California that of those 82 deaths, some of them might have been assisted suicide. We simply don't know. Okay, we simply don't know. Uh, Oversight of the law. They say, well, we're going to legalize this and it'll give us oversight of what's over. They often argue, well, assisted suicide happens already. So by legalizing, we'll have control of the law. Do they actually have control? The answer is no. The other thing you're going to notice that if you look at the data, but also the rules for California, Oregon, Hawaii, the government doesn't actually fund, they do not provide funds to the Department of Health to actually investigate to find out what actually happened. So they're completely counting on the doctor to send in the reports. Hawaii just came up with a report. And remember, this is the first year for Hawaii. Hawaii assisted suicide became legal on January 1st, 2019. There was 15 reported assisted suicide deaths in the first year, 30 lethal prescriptions. Hawaii did not provide any information about the other 15. We don't know anything about them. Okay, it just doesn't tell us. Okay, the report. We do know that between January 1st and June 26th, because the first year provided there was 15 assisted suicide deaths. They gave us the data for almost the full 6 months of this year, and it shows 13 reported assisted suicide deaths. Now remember, this has only been in place for 1 full year. And when you're reading the report, what does the Hawaii Department of Health recommend? They recommend eliminating the waiting period. So there's a waiting period in Hawaii for assisted suicide, and they're saying, well, we should eliminate the waiting period. And they're also suggesting that they should permit nurses to prescribe the lethal assisted suicide drugs. Now, for your information, Canada is the only jurisdiction that allows both doctors and nurses to do the act. Okay, so if you go to Oregon, or if you go to Washington State, or if you go to the Netherlands and Belgium, it is doctors who will do the act. Now, I know Switzerland's a little different, but that's, I'm not going to get into Switzerland. It is definitely different. Nonetheless, Hawaii is talking about nurses. Now, why are they talking about nurses? Well, I read an article just a couple of months ago that they say the problem with assisted suicide in Hawaii is there's too few doctors willing to do it. You can actually see that in the report, because they're actually in the report listing, they only have a certain number of doctors willing to prescribe assisted suicide. And it even makes the comment, oh, we finally have someone from this island willing to do it. So what they're saying is, if we can permit nurses to be involved with prescribing assisted suicide, that will increase the numbers who are involved in the act. Once again, I say, why is the government recommending expanding the law when it's only 1 year into the law? Let me give you some background to this, and I know it's 223, but I think this background is very helpful. They had tried to legalize assisted suicide in Hawaii year after year after year after year, and they failed. And so what happened is in 2018, the assisted suicide bill, they defined it in such a way as to say to those members of the Hawaii legislature who are always voting no, well, we've made sure we've tightened the law. So in order to get it through, they had to say we've tightened the law. We've defined things properly. So they got it through. They've legalized. And now what are they doing? They're expanding. Sounds like what's happening in Canada. The New Jersey Assisted Suicide Act, it came into effect on August 1st, 2019. So it's been it's more than a year now, I guess. But the report was for 2019. Now what happened in New Jersey is there was an injunction by a Jewish doctor that was sought and granted based on the Suicide Act, that he was challenging the Assisted Suicide Act, and that injunction was rescinded on August 27th. So what you're seeing in the very beginning of the assisted suicide law in New Jersey is a legal battle as to whether it actually is in play. In fact, the New Jersey assisted suicide law has been in the courts a whole pile also in 2020. So they said there was 12 people who died by assisted suicide in the first 5 months of the law. I'm suggesting the reason that the number was as low as 12 was because of the legal question as to whether it's going to be struck down or not. The report only, though, gave us basic data. If you read the report, you'd say, like you're saying nothing in the report. In fact, the report also doesn't state the number of lethal prescriptions that were written. So I don't know if there were 30 lethal prescriptions or 20 lethal prescriptions written. All I know is 12 people died by assisted suicide or reportedly died by assisted suicide. I talked about the Delta Hospice. So I got my, I edited my slides, and there you go. Is euthanasia about freedom and autonomy? This is the big question that we keep getting thrown at. And we know that, of course, this is the selling point. It's about my freedom, my choice, they say, but is it actually about that? Well, we know about the story of Candace Lewis. Many of you know that Candace Lewis passed away this year of natural causes. She was born with multiple disabilities, and in 2016, she was pressured by the doctor in Newfoundland, who, when she was in the hospital, quite sick, she was pressured by a doctor to ask for euthanasia. Candace never asked to die, but because of her level of disability and her health condition at that time, the doctor thought it was a better thing for her to do. Last year, I received a call from a woman in Ottawa whose brother-in-law was approved for euthanasia. This is an important story. Her sister was upset about her husband's planned death by euthanasia. And so what I was talking to the sister-in-law, because she told me that, I said, well, why is your brother-in-law's wife not calling me? And she said, well, my sister's so upset about her husband's planned death that she can't speak to you. She just can't speak about it. I spoke to a long time to this woman and her husband about their brother-in-law, and her husband agreed to visit him and to speak to him on a man-to-man basis, because this was my question. I couldn't understand how a couple who had been married for 50 years, how she was completely opposed to euthanasia, and the doctor, and the husband was planning to go ahead with it. It just boggled my mind, because this was a 50-year marriage. I told the brother-in-law to talk to his brother-in-law about the pain that he was going to end up giving his wife of 50 years. By dying by euthanasia in this way, he was going to transfer the pain to his wife. And that was the message he talked about, how this pain was being transferred to the family and specifically to his wife. And he changed his mind. The brother-in-law changed his mind. He decided not to die by euthanasia. What was important about this case is the palliative care doctor was then called, and when he had changed his mind, and he assured the man that if he was suffering, that he could be sedated. It's an important point, because he was afraid, the man was afraid of suffering. The brother-in-law, he died a natural death the very next week. So he was very near to death. And I asked the family, since he was already near to death, why did he want to die by euthanasia? I thought it was a very important question. They told me that he said he was tired of dying. It was an interesting point. He had lived several months through the process of dying, and he just wanted it over. And I responded by saying, these are normal human feelings. It's important that we recognize the normal human emotions and feelings, that we be with others and we deal with people who are going through normal feelings and maybe dealing with it in a different way. Why? When euthanasia becomes legal, it becomes an option. So this was driving the issue for this person, that they were saying, I've been dying, I'm nearing death, I want it over. I received a call from a woman who was completely opposed to euthanasia, but her husband was living with MS and he had been approved for euthanasia. This is another Canadian case. She wanted to stop the death. She was opposed. She thought this was absolutely wrong. She understood her husband was going through a difficult time, and she was completely a loving wife. She visited him regularly. He was not living at home because of the level of his debilitation. He needed total care. Her husband agreed to meet with a physician who I had contacted. This physician got permission and read through this man's medical records, and he concluded that this man was not dying. He had MS, he was debilitated, so if you consider his level of disability, he was at the point where he needed near total care. There was no question about that. So his wife, the woman, called the euthanasia doctor, the doctor who had approved him, who was going to do the euthanasia, and asked, how come you approved my husband? How did you approve my husband for euthanasia? He's not dying. Yes, he has MS. He's not dying. And what did the doctor say to the man's wife? The euthanasia doctor told her, your husband is bedbound, which in this case was true. Therefore, he could develop a bed sore at any time. Therefore, his natural death is reasonably foreseeable. You can see why I'm concerned that Bill C7, as bad as it is, continues to use the term natural death is reasonably foreseeable. It lacks meaning. It lacks any ability to protect anybody whatsoever. Her husband also was quite clear. He wanted to live at home. He wasn't seeking death, but he was quite clear. He was living in a nursing home where he needed total care, which meant in that nursing home, nearly everyone had Alzheimer's or dementia. That was the type of level of care he was receiving. He was depressed. He felt he had no reason to live, and he died by euthanasia. I think we have to understand these issues in the sense of what does it mean to be human? How do people react to these things? I think that's more important than anything else that he needed to be with his wife at home. That's where he needed to be. But there was no way to provide that for him within the jurisdiction because they were not offering the level of care this man needed. He would have been happy to continue living if he had the level of care he needed and lived at home. Why do people ask for euthanasia? We're told that people ask for euthanasia because of pain or physical suffering, but the data suggests that very few people are actually killed for these reasons. The data doesn't suggest that at all. That's what they sell to us when they're trying to legalize euthanasia or assisted suicide, because of course, that's what moves the culture. We're told that, okay, we know that some people are radical autonomous. So I'm in no way questioning that there's a group of people who are demanding death. That's exactly a reality. Most people ask for death because they're at a difficult time of their life. They're going through serious, whether it be a psychological or a physical crisis. They feel alone, depressed, socially isolated. They've lost hope. They've lost purpose. This is my experience. I've talked now to many people, to their families, and to individuals. I got a call recently from a woman who was wanting euthanasia. She was in a situation where, now this had a lot actually to do with the COVID situation because she had COPD. She was, had some financial questions. She was alone, but because of COVID, she was saying nobody visits her anymore. She says, I can't go to the stores. I can't go around. I've got to carry this tank with me. I have these health conditions. She wanted to be dead. What she needed was a community of caring people who did certain things to allow her life to feel manageable, to help her find hope and meaning and purpose, and to deal with these difficult times. So I'm going to contend, and if you're someone who does research and you disagree with me, we can have this discussion. I contend that the reasons people die by suicide are similar, not exactly the same, as the reasons that people are dying and asking for an assisted death. The circumstances definitely do differ. I think that if you consider the emotional, the psychological level, the driving forces, I think they're very similar. Most people ask for an assisted death because they feel their life lacks purpose, meaning, or hope. They feel that no one cares about them or that they have become a burden to others. They feel they've lost meaning because they've lost abilities. When you look at the data from the Canadian stats, even though it's sort of hard to figure through, you realize that people are asking for euthanasia because of the social reality, not because of their physical realities per se. These are normal human feelings people have. When a person is lonely, depressed, socially isolated, or feeling abandoned, their lives are threatened then by euthanasia. Because it's legal, it's an option, it becomes something that's thrown at them. This euthanasia, it threatens my life, it threatens all of our lives. Human experience tells me that it's normal for a person who's experiencing a serious illness or personal difficulties and loneliness will also fear for their future, question their purpose for living, experience existential distress or situational depression, or lose hope. Suffering alone, loneliness, isolation, depression, loss of hope, these are all leading reasons when you dig down as to why people are asking for euthanasia. Oh, Jackie's waiting. I didn't notice Jackie. Sorry, Jackie. She joined us late, but that's okay. Okay. The culture of abandonment that leads to assisted suicide can be changed by caring for others. I actually should get into one more story because we're dealing with a case right now. You're going to probably be hearing about it in the media. And I know this is now going to be seen, but I've been dealing with a case And well, we've been dealing with a case of a woman whose husband has been approved for euthanasia. And she contacted us because she was shocked that her husband had been approved for euthanasia. It's interesting how all these cases in particular of husbands and wives, it tends to be the husband asking for euthanasia and the wife who's upset about it and seeing that there's something wrong going on here. In this case, and this is what we're dealing with right now, we're trying to set a precedent right now with this case. But what's happened is that the husband had gotten approved for euthanasia, but he went to the first doctor and he got approved. And he needed to go to the second doctor. The second doctor turned him down. Now, meanwhile, his wife is shocked that the first doctor even approved him because he has some health conditions and he is older, but he's not sick and he's not dying. He's simply not sick or dying, but he thinks he has a lot of problems. He is convinced he's got all these health problems. And so the second doctor, when examining him, said, this man isn't dying. He could live for a very long time. There's nothing about this man which tells me he's actually dying in any way. So he's going through certain issues, whether you call them psychological or not, which makes him believe he's got a lot of health problems, but in fact he doesn't. And his wife has been with him for 40 years is saying, well, this is not new for him. This is not new for him. But he was approved for euthanasia. So think this through. Somebody who's clearly not dying, who has, yes, some health conditions, but nothing really that in any way would lead to his death, was approved by euthanasia in Canada. So what happened is after the second doctor said no, the euthanasia group in that province then moved him to a third physician who actually was the leading physician in that province doing the most euthanasia deaths, and he was approved again. So anyway, we got an injunction last Friday, and there's going to be a hearing in the Friday coming up. So we got an injunction to prevent the euthanasia death on last Friday, and there'll be a hearing on this Friday coming up, and we're going to see what happens. Because in the law in Canada, there's no mechanism for challenging these medical decisions. There's no mechanism at all. The wife of this man who's been with him all these years knows he's not dying, but has no legal rights, but the court has granted us a hearing. So we're going to see what happens. But this is the kind of thing we're dealing with. But let's get back to this whole issue of the human person. It is essential that people who feel that they lack value or feel that no one cares about them are offered purpose, support, genuine hope. We need to be a significant community for others. It is a very difficult life for people who are alone and going through difficult times. The answer is to care for and be with others, help them journey through their difficult time of their life. The problem with euthanasia is now that it's legal, it's always an option. It's always an option. As I say to people always, I cannot change the world, but I can change the world around me. So some of you have seen some of this data because I've written about it. Recent Copenhagen study, which actually was done in 2018. And it was done on people who had had a heart attack. So this is a very large study that looked at everyone who had had a heart attack, all women, everyone who had a heart attack over a period of time. And it says women who describe themselves as lonely were 3 times more likely to die within a year of a heart attack than those who had an active social life. And men who described themselves as lonely were twice as likely to die within a year. So what they're saying is all they were doing at this data from the study is looking at people who had had heart attacks, and they noticed that those who had described themselves as lonely or depressed, that these people were more likely to die within the year than those who were not feeling the loneliness. Patients who were lonely were also 3 times more likely to be anxious, depressed, and they reported a lower quality of life. A survey of 1,896 seniors, 65 and older in the UK, more than 1 in 5, 22% said that they have a conversation with no more than 3 people over the span of an entire week. Now, we've been going through this COVID issue. I'm assuming that in fact that 22% numbers jumped because the number of people who do not speak to 3 people in the span of an entire week has got to have gone up when we have to social distance. When I'm talking about the woman who called me wanting euthanasia and we had a long conversation, and what she was saying is, no one visits me anymore. I have nobody in my life. She wanted to die not because she was dying, not because she was going through a difficult time. There was no question about it. She had health conditions, but I mean, she wasn't dying, but she wanted to be dead because she was so lonely. She was so depressed. She felt so isolated. A quarter of older adults said it makes them feel good when somebody smiles or acknowledges them while in a waiting line in a place. You can't even smile at someone with a mask on, but that's well, maybe it's necessary right now. It makes it more difficult, is what I'm saying. While they're in a line at places like a bank or a grocery store, 1 in 5 would be thrilled if someone stopped and asked them, "How has your day gone?" 1 in 5 of the 1,896 seniors 65 and older in the UK answered that question, that they would be happy if someone just simply asked them how their day was going. U.S. Census Bureau of there's 12.5 million older adults living in one-person households in the U.S., representing 8% of all people 65 or older. And a national poll on healthy aging. This was done by the Association of Retired Persons. 1 in 3 senior citizens said they are lonely. Research shows that chronic loneliness can impact older adults' memory. I'm getting older, I guess. Physical well-being, mental health, life expectancy. And so the report suggested that we have a serious problem with loneliness. And of course, I'm arguing that has led into our problem with euthanasia and assisted suicide. More than a third of the seniors in the poll said they felt they had a lack of companionship, and almost 30% said they socialized with friends, family, or neighbors once a week or less. Once a week or less. So I'm arguing that if we visit people that we know, we journey with them, we're being with them, we're caring for others, we help affirm a person's purpose for living, not because you're showing a caring response to people, and as a human being that affirms them, that helps them, we reduce their loneliness and isolation, even if we just simply pick up the phone and talk to people. Do you know somebody who you've known for years? We help them find a way through their depression and isolation. We allay their fear of suffering. We will reduce the number of people who feel their life has no purpose or value, which is leading to this euthanasia issue. So Euthanasia Prevention Coalition has been involved with this compassionate care charity, compassionate community care charity, and the purpose of it has been now actually a little bit difficult because of the COVID-19 crisis. It's involved with several things. One of the things it does is it deals by taking phone calls and information and helping to talk to people who have medical issues or who are dealing with issues of euthanasia and assisted suicide, and help them to deal with those issues, trying to get them. So it's usually a family member who calls or a friend who's calling, and you try and convince them that if you can do this, you can at least help the situation, lessen the chance that this person will ask for euthanasia or assisted suicide. Maria R. wants to be admitted. That's very interesting. We can change the world one person at a time. The compassionate community care programs involved with training volunteers. One of the things that has to really change, of course, is what we're doing in the training, because of now you have the situation of the social isolation. We are all affected by the legalization of euthanasia. If you're in a state that's legalized assisted suicide, I know that we have someone from New Zealand on. I think Vincent Keme got my time wrong because he's joining us now. If you're someone who's in New Zealand and they're right now pushing to legalize euthanasia, you understand that once it's legalized, it does change the culture, because it becomes an option. People who are experiencing human emotions and feelings suddenly are now thinking about euthanasia as an option. Cultural loneliness affects our health, it affects our quality of life. It can be a threat to our life now that euthanasia is legal. I'm going to throw something up there now. I have to see now, how do I get my, I want to see the questions that might be coming my way, and I can't see that on my screen. Emily, can you come back here and show it to me? Because I don't know where it is. Some of you want to sponsor. I'm doing a half marathon run on October the 4th in Hamilton Bay. I'm doing this with a friend to support the Compassionate Community Care Charity. And so, is it here, comments? Where is the chat? Exit screen share? I'm not seeing the chat. Chat's right here. Okay, so there were, yeah, I can't hear you talking. Sorry, that came up later. Okay, so there aren't any, if anybody has any questions, they can then send it to me. So if you're willing to support the Compassionate Community Care Charity, I'm doing a half marathon run on October the 4th. I've been training for this for quite a few months now, and I think I'm doing quite well at it. The chat is open for questions. If not, there might be some more questions. I'm happy to send you all my PowerPoints, my information. If you have any other questions, I can send it to you. You can email me at info@epcc.ca. What is the process for getting the slides for this presentation? I can email it to you. I wish to underline the difference between California and Canada. Well, I can do that for you, Gordon. California has assisted suicide. Canada has euthanasia. California, it's been a shorter period of time, but assisted suicide, you get fewer deaths than you get when you have euthanasia. And why is that? It's far easier for me as a human person to get somebody. Yeah, I know the difference is 40 to the multiple. Yeah, I know there's a huge difference between California and Canada, Gordon. You're absolutely correct. It's a massive difference. And the reason is that euthanasia, anywhere you look at it, is a far higher number. So therefore, the reason is it's easier for me as a human person to have someone lethally inject me. It's far easier than for me to take the drugs myself. If you consider assisted suicide numbers in Oregon, Oregon's had assisted suicide for a little over 20 years. Now, I know that the Oregon law, if there were euthanasia, I don't think it's possible to prosecute because of how the definitions work. Nonetheless, because it's assisted suicide, that means you have to technically take the drugs, the lethal drugs yourself. And there is a natural negativity to that, okay? Whereas in euthanasia, someone is actually injecting you. So the difference between euthanasia and assisted suicide is assisting a suicide, whereas euthanasia is a homicide. Someone is killing me. So once again, it's easier to get someone to kill me than it is for me to take my own life. Is there an organization in Canada that has all available stats in Canada? Well, I have all available stats in Canada that's been available. Yes, Rose. You can email me. I'm happy to send it to you. Is Compassionate Community Care a charity? It is a charity. Yes, it is. Does it have provincial chapters? It is run right now out of London, Ontario. The recording will be available, Jane. We can send you the recording. It will be available. There's not a problem with that. And the PowerPoint can be made available to you. Sorry this was covered, but is there any indication when Bill C7 will be moved forward? So right now, still Bill C7 is not going anywhere because the federal government is not dealing with anything else but the COVID-19 crisis. Well, I guess they're dealing with the We Charity. I shouldn't say that, but it's true. The fact is that Bill C7 will be possibly debated in September. So that's the next time it might be debated because there won't be any bills in the federal parliament outside of COVID-19 issues that will be debated until late September. The federal government received from the Quebec court an extension until December the 18th. So on December the 18th, whether the federal government is imposed Bill C7 on us or not, what's going to happen is that the Quebec decision will go into place. Please send email. I can send email for anything that you want. Just email me at info@epcc.ca, info@epcc.ca. Also in CA is, okay, whereas Canada is officially proclaimed, yeah, I know, that's exactly, in Canada, we're calling euthanasia good, Gordon, and that's part of it. And there's also a far more greater promotion of euthanasia in Canada than over at California. What's interesting is in California, I think there's been another factor. Last year, there were fewer assisted suicide deaths in California. One of the reasons is that there was a court case challenging the legality of the California assisted suicide law, and they had received a temporary injunction against the law. So for a period of time last year, assisted suicide then was not legal, and then the injunction was then challenged and overcome, and what happened is that, of course, it came back into place. But what that did is it created, first of all, a situation where no assisted suicide deaths could happen in California when the injunction was in place. But secondly, what it did is it created confusion as to the legality of the law itself. Why do we call it euthanasia? That's just what we call it, Father Dominic. Really, what it is it's lethal injection. What it is it's homicide, is what it is. Others call it mercy killing. In Canada, they'd like to call it MAiD, medical aid in dying, but that's just to make us all feel better about it. Are there any steps we can take to help reform the poor state of long-term care homes? Well, this has been a serious issue, the long-term care homes. COVID deaths in Canada have been ridiculous, and I'm not saying they're not ridiculous in other states or places in the US, but the fact is that we had gone through a huge number of deaths, and I think the long-term care homes also then lead to euthanasia because of the fact that people would say they would rather die than be in a long-term care home. How can this be reformed? Well, there's many ways it can be reformed, but one of the things I think we have to do is we have to go much more to a home care model. I'm absolutely convinced that institutional care is not the answer. It is the answer in some cases, because obviously when people have high needs of care, sometimes there may be no other way to do it. But I mean, in our culture today, we've come to accept institutional care for our elderly, and I think it's absolutely the wrong way to go. I believe in home care. I believe in community care, keeping people in their communities. I believe in providing the care they need. It also then creates an interconnection in the community, which is so important. What we've lost is this feeling of that these elderly people are part of me. They're part of my community. So it's easier to forget that they exist. It's easier to end someone's life or to ignore them or to take advantage of them when they have no value. They're not part of my community. I believe it's the right way to do things is to go to a higher level of home care to provide the options. And that's a major change in the culture that would be needed. Major change would be needed for that. But it's absolutely, in my opinion, necessary to do that. It seems that Bill 7 C7s disregards some of the warnings and safeguards recommended by the Council of Canadian Academies expert panel. It does. I agree with you. They played a game, though, with the whole issue of mental illness. And I'll get into that again when I said that at the issue of mental illness, they said in Bill C7, it appears that it blocks euthanasia for mental illness, but in fact, it doesn't. And this is a serious problem because it's all a matter of semantics. That in order to do that, they would have had to redefine the term psychological suffering, which they have not defined. By not defining the term, you're actually leaving it open. So someone who's asking for euthanasia for psychological suffering, it could very well be an issue of mental illness. So I agree completely that many of the recommendations have been ignored. The other thing about Bill C7, it will be challenged in the courts. The Canadian Bar Association has made it very clear that there's certain parts of the law of the bill that actually are unconstitutional, which I've pointed out too. And so therefore, I wrote an article about this, quoting the Canadian Bar Association saying, I don't agree with their direction, but I agree with what they're saying, that yes, there are certain things about Bill C7 which will be challenged in the courts and would be struck down. Is there any significant visible opposition in the Catholic or Christian churches to euthanasia-assisted suicide? And the answer is a little bit. How can we advocate for home care or self-directed care? Jen, this is a political issue. And it's very, very, very important that we deal with this. We have to meet with our members of parliament. They're now talking about in Ontario, for instance, improving long-term care, and there needs to be some money obviously spent on that because some of our long-term care is absolutely terrible. Nonetheless, to advocate for this becomes a political issue. And I think it's a winning political issue because it provides choice, minimally speaking, it provides choice for people who do want to care for their loved ones or be cared for by loved ones in their homes. Other than sending cards and phoning, what can we do to alleviate someone's loneliness? You need to actually try and be with people. I think that being with the other is so important, and it's a difficult time right now for that. But I think that listening to someone, talking to someone, asking them about their history, who they are, asking them about what important parts of their life, what do they do in their life, acknowledging them as a full human being makes all the difference in the world for someone. Somebody finds meaning and purpose when someone actually cares about them. Do you see a reflection of the same factors that lead to consideration of euthanasia also reflected in issues surrounding higher rates of drug over? I think that yes, I do see that there's a connection, that the culture has become one of real loneliness and difficulties with the issue of drug abuse. I have a friend in New Mexico, and I know it's New Mexico and not Canada, but that's fine. The fact of it is that I have a friend in New Mexico, and and maybe I shouldn't be getting into this, but his son's girlfriend just died by suicide, and it was devastating. And the problem with the whole situation is she had a drug problem, and she was going through a lot of difficulties. Now, what about Canada? I think the same thing is going on in Canada, where we have a higher rate now of problems. And how do we deal with it? I think that this does lead to euthanasia and assisted suicide, this whole what I call this breakdown in the culture, and interconnectedness is really what is needed. See, we've been lied to. We believe and we're told that this is all about me. I am a human being who can make my own decisions, do what I want, and I'm an individual. Well, certainly I'm an individual. All of that is true, but at the same time, I need others. And we've become so individualistic as individuals that we've lost the sense of the other. But you see, it is it's two-sided, because by becoming so individualistic, I become too concerned about myself. And I'm not judging you or anybody. I'm just saying that's the general human reality. Dr. Margaret Cottle, she refers to the Denmark model, integration into society. There's actually something very interesting. In the Netherlands, they built a community, and the Netherlands has a lot of problems, obviously. Yeah. But they did something really well. They built a community for people with Alzheimer's. So if you have Alzheimer's dementia, there's a town they built. So they, they have, everyone's got their own. It's not an apartment. It's not. They have their own hut, their own place, and it's enclosed in such a way so they don't have any fear of someone wandering off and getting hurt. But then they live in that community. They can go grocery shopping. They can go to the coffee shop. They have everything there, and it's set up as a community. I think that was absolutely wonderful that they did that. It was such a, and I can actually send you some information about it. But to me, in the sense of someone with Alzheimer's or dementia, that was the proper way to care for them, because they're humanizing them. They're keeping them seen and feeling in a human model. Work and prayer help us, give us purpose. Absolutely, certainly, we all find purpose in these things. What else do we find purpose in? We find purpose in understanding our nature as a human person, that I am part of the community. I am interconnected. I have an importance. I am not just somebody who has existed. I do exist. These are all important things. And we recognize, when we're trying to recognize the importance of the human person, we're doing so by recognizing that that person is somebody who has lived a life, who's done important things, and who continues to be important. The other thing about looking at this issue, which is important, and I think we have to talk about this, is that even though all of us have budget issues and whatever else, it doesn't matter. We have to define these questions and these issues based on what affects the person who's hearing it. And this is so important if you're trying to stop euthanasia, but also if you're trying to lessen it, or how would you say, protect the culture in some way from this. And so I really do believe it's important to base our arguments on where the average person is at. We talk about them and see how things resonate with the individual, how we are in the culture. It's approaching 3 o'clock, so I think we're done. If anybody has one more question, they can give it to me. If not, you can email me at info@epcc.ca. I can go back to, I can escape out of here, and I can, no, it doesn't want to escape out of here, doesn't it? Yes, it does. And I can go back to this. You can make a donation to Compassion Community Care from our run on October 4th. I think this is something I've been working very hard on, and I'm hoping people will support that. I'm going to do my first half marathon. I've been doing a ton of running. And if you want to find out more information about Euthanasia Prevention Coalition, there it is right there. And if this, I'm hoping this is still on the screen. So anyway, thank you very much. It's 2:58, and we had quite a few people participating. I'm very thankful for you helping out with this. We only are effective when we're together and when we work together. And I thank you very much. And until the next time, see you later.